this is Dr. Sandhya from Dentistry. I am here to explain how to maintain your teeth and the soft tissues of the mouth during the course of your orthodontic therapy. As you all know, the orthodontic therapy ranges from 1.5 years to 2 years. So it becomes a complete responsibility to take care of the health of the teeth and the other soft tissues. Now when I say the health of the teeth, I mean to say we have to prevent teeth from getting into cavities or decay. When I say about the soft tissues, you have to take care of the health of your gums. They should not bleed, they should not swell, the teeth ultimately should not become loose. So it becomes a huge responsibility to take care of the health of the oral cavity in total during the entire course of orthodontic therapy. Now for you to understand well, I would explain it into 4 different parts. Now the first part would cover how to take care of the teeth alone from cavities. The second part, how to ensure good salivation all through the course of orthodontic therapy. The third part, how to maintain the health of all the soft tissues of the mouth. And of course, the fourth most important would be the food. The food to avoid and the food to embrace. So to start with, I would first detail about how to take care of your teeth during the course of ortho treatment. We at Pearls Dentistry prescribe an orthodontic oral hygiene kit. Now this is the orthodontic oral hygiene kit. When I open the kit, I have 8 different constituents inside the kit. The first and the primary would be the orthodontic toothbrush. Now this is an orthodontic toothbrush. It has 4 rows of bristles. The outer 2 rows of bristles are placed high and the middle 2 rows are placed at a lower level for a specific purpose. Now the second would be the regular bristles, the regular toothbrush or a toothbrush with a serrated or a roughened backside. Next would be a toothpaste. The toothpaste, I would recommend any brand, but see to it in the composition it has any form of fluoride in it. Now this is a toothpaste which has sodium monofluorophosphate as an ingredient in it. Next would be a very important component called as the interdental toothbrush or the Proxa brush. Next would be the fluoride mouthwash. Any brand is accepted, but it should have an ingredient of fluoride in it. Now this is a brand which has sodium fluoride incorporated in it. Next would be a handy any antiseptic analgesic gel to have it. These are the few applicator tips to apply these antiseptic gel over your soft tissues. And the last would be few bubble gums in hand. Preferably sugarless chewing gum in hand. Now each has its own specific purpose, and now I would explain you what is the purpose of each ingredient in it. Now the first would be the orthodontic toothbrush. Now brushing is mandatory in an orthodontic patient. There are 3 types of brushing. 1. Brushing with an orthodontic toothbrush, 2. Brushing with the Proxa brush, and 3. Brushing on a regular brush. Now first I would go to an orthodontic toothbrush. This is a toothpaste, a fluoridated toothpaste. Normally dispense on the middle of the toothbrush a peanut-sized toothpaste. After dispensing, with the index finger, rub the paste and make a smear on the surface of the brush. After which you gently tap on a flat surface so that the paste settles completely over the bristles and little lower inside the bristles. Then we start brushing. First we start brushing the upper teeth and then go to the lower teeth. Upper teeth spend around 2 minutes and lower teeth spend around 2 minutes. First I would demonstrate on an upper teeth. Now the bristles which are placed in the middle, they are designed to clean the brackets. And the length of the bristles is such that they cover 3 teeth at a time. So first, using the middle bristles, keep the bristles over the 3 brackets and do subtle circular motion. Now always while brushing, maybe a regular tooth or an orthodontically treated tooth, brushing should not involve long-sided movements like this. It should involve subtle, gentle finger movements. Now when you cover the bristles with the 3 brackets, make circular motion, jiggling, I would call it jiggling circular motion, removing all the debris, all the plaque, all the bacteria that is covering over the brackets. Now again, after circular motion covering the 3 back teeth, come forward and cover next 3 brackets, come forward, come forward, come forward and finish the entire arch. Similar to the lower set of teeth like this, keep your bristles over the brackets, cover 3 brackets at the time, cover 3 brackets at a time, finish the entire length of the brackets. Next, go to the area which is present above and below the brackets. Exactly when I point it with a pencil, this is the area above the bracket, area below the bracket. To clean the area above and below the bracket, your bristles should be first placed on the gum line on an oblique direction like this. Keep the bristles over the oblique direction over the gum line and again give a jiggling circular motion covering the 3 teeth at a time. Something like this. Can you see? Can you see? I'm forwarding, I'm moving the brush, I'm moving the brush, I'm moving the brush, cleaning area above the brackets. Now come to the area below the brackets covering the teeth like this. Alright, so cover the teeth, cover the teeth, cover the teeth, and so we have cleaned the area above the bracket and below the bracket. Now use your regular brush. Use your regular brush to clean the area which is called the chewing surface. When you see the chewing surface, see how irregular they are. They are prone to retain the food what we eat. So using the regular brush, keep it absolutely perpendicular, covering 3 teeth at a time from the back and give 5 strokes for 3 teeth. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 and 1, 2, 3, 4, 5. So we have covered the chewing area. Next of course comes the back side of the teeth which we always neglect to. While cleaning the backside of the teeth, use a sweeping motion like this. See my fingers, see my wrist how it moves. So this is the sweeping motion which I recommend to clean the backside of the teeth. So keep your bristles and do a sweeping motion. A sweeping motion. Alright, this is on the upper. Similarly on the lower, a sweeping motion to clean the backside of the teeth. So this finishes cleaning over the brackets, above the brackets, below the brackets, on the chewing surface and backside of the tooth. So this is cleaning by an orthodontic brush, cleaning with a regular brush. Next is the most important which I am going to tell is cleaning with a peroxide brush or an interdental toothbrush. Now it consumes time, I am telling you it really consumes time, but it is mandatory we brush with this interdental toothbrush. Now keep the interdental toothbrush in between the wire and the tooth. Please watch it carefully, keep it in between the wire and the tooth and clean the area out of bacteria, out of debris in between the brackets. Are you able to see? I am cleaning the area in between the brackets. Your regular brush, your orthodontic brush cannot clean the area in between the brackets. Only an interdental brush will be able to do it. So gently, slowly, without disturbing the bracket, without disturbing the wires, clean the area in between the bracket and your tooth. Again, going on to the lower teeth. Can you just see? I am keeping the bristles, the peroxide brush bristles in between your bracket, the wire and the tooth. Please watch it carefully. Please watch it carefully. I'm cleaning it on this side. So it clears off the teeth from bacteria, from debris, from food particles which are stuck on these areas and gives a good oral health for the teeth. Cavities least form if the teeth are maintained in such a way. So brushing is done. I used 3 different brushes. 1 is your orthodontic, 2 is a regular brush and 3 is the peroxide brush. Brushing is done. Next, go to rinsing. Now rinsing, after brushing, take half glass of water, put little salt in it, put it inside your mouth, swish it nicely for 10 seconds and spit it out, and this is rinsing. Rinsing should be done after everything whatever you eat. Even a biscuit or a glass of juice or coffee, you have to rinse your mouth with plain good water. After rinsing comes the tongue brushing. For tongue brushing, do not use a metal scraper to scrape out the tongue. Either use a regular brush bristles without any paste or the backside of the toothbrush which has serrations in it. Now stretch your tongue out and 5 gentle strokes over the surface of the tongue will completely clean the tongue. The foul odor, normally what we get from an orthodontic patient, is more from a dirty tongue rather than the tooth. So tongue brushing is done and tooth brushing is completely done. Next comes the fluoride mouthwash. Fluoride rinsing can be done once a day. It can be done either in the morning or in the night before going to bed. I would suggest you to do it in the night before going to bed because you use a mouth rinse of fluoride and then sleep. So the action period of the mouth rinse in contact with the teeth extends all through the night. So it's a good idea to use the mouth rinse in the night rather than in the morning. Now how to use the mouth rinse? Take 1:1 dilution. Take 10 ml, say for example, half the cup. Are you able to see the cup? Half the cup of this bottle. Fill it with the mouth rinse. Again 10 ml, dilute it with good water. Put it inside your mouth. Swish it for 30 seconds. 30 seconds is very important. Less than that, the action is not much. So 30 seconds completely swish it and spit it out. Most important, you cannot drink, you cannot eat or do, even I would not ask you to speak after rinsing with fluoride. Why? Because you do it, the fluoride rinse which is attaching onto your tooth gets dissolved, it goes inside. So to ensure complete contact of the rinse, of the fluoride rinse with your teeth, do it at the night, swish it for 30 seconds, spit it and then sleep off. So you ensure very good action of fluoride rinse in contact with your tooth. Of course, next comes this gel. Now normally after the orthodontic treatment on the day 1, when the brackets, when the wires and when the bands are placed, sometimes you might have some poking sensations here and there and you may land up with ulcers. What do you have to do? You have to immediately call up a center and fix an appointment, and before that take your antiseptic gel with a clean finger. Apply the antiseptic gel over the ulcers after food 3 times. This is a handy tool which is present. Next comes the chewing gum. Why? Sometimes you can have the brackets which are broken hanging loose, the wires which are come out hanging loose in the mouth. What to do? First time, you have to call up the orthodontist or center, Pearl's Dentistry Center, and fix an appointment and inform what is the trouble. But you might not get an appointment with the dentist on the same day. You might have to get it on the other day. So till while coming to our clinic, take a part of this chewing gum, cut it into 2 and place it, stick it over the area which is poking on the tooth. Maybe over the wire, maybe over the bracket, so that your chewing gum will prevent your brackets or the wire in contact with the soft tissues and prevents ulceration. Now sometimes some ligature wires which are present on the brackets can come out hanging. Using a pencil rubber, you will have sometimes a rubber which is jutting out of the pencil. Using a pencil rubber, you can push those ligature wires inside till you meet your dentist for the next appointment, so that those ligature wires do not hurt you. So this is all about the orthodontic kit and how to use them. So please do get the kit and see to it you maintain your teeth in a very good shape until your orthodontic treatment is over. The second part would be to take care of the salivation. Saliva is a natural cleansing agent of the mouth. It clears off the debris, the bacteria, the food particles which are present in the mouth by just washing them through inside your gut. So we should always ensure a good flow of saliva inside the mouth, especially during this orthodontic course of treatment. Now to ensure good flow, if you are a natural good saliva producer, good. Otherwise, see to it, naturally you consume lot of oranges, lime juice, lemons, any citrus fruits, natural, which has good amount of vitamin C because they stimulate good salivation. If you are not salivating much, then we can also prescribe you with vitamin C powders under water or vitamin C chewable tablets called saline tablets, which can be consumed once a day, which ensure good saliva production inside the mouth. Now when you come to our center, Pearls Dentistry Center, we also check your saliva through these pH indicator strips. Now these pH indicator strips should be just dipped in your saliva, wait for a color change. Now the color change might go from an order of pink, yellow and green. If it goes to the green, you are on the safer side. Your saliva is either neutral or on an alkaline side. A saliva which is on the alkaline side is very good because bacteria do not much grow in an alkaline environment. If your saliva indicator, pH indicator, shows your saliva is on the red or on the yellow, you are on the danger side, which means your salivary pH is more on an acidic. In an acidic environment, it is highly conducive for the growth of bacteria. So please come to our center. During every checkup, we will also check the pH of your saliva. If there is acidic saliva, the remedies would be to make it more alkaline, and number 2, to increase the flow of saliva. As the flow rate and the pH becomes more alkaline, then it is not a very conducive environment for the bacteria and therefore you prevent cavities. So this is regarding saliva. The third part would be how to maintain your soft tissues. The soft tissues are very important because they help in talking, they help in eating, chewing foods. So normally for our orthodontic patients, we prescribe a multivitamin dose, either combination of zinc for a period of 2 to 3 months based on their general health. It is so mandatory that you either any form of multivitamin should be consumed once a day for a period of 3 months. Especially for female patients, we also give an add-on iron tablet for them to be as a supplement to take care of the health of the soft tissues. The last segment, the most important, would be the food. Now what are all the food that you should embrace and what are all the food that you have to avoid? Now when you see this chart, I have written few foods to avoid and few foods to enjoy. Basically, I am telling you the food which are hard, say the nuts and huge apple, a huge raw mango, popcorn should not be consumed. Why? They might break the bracket, they might displace the ligature wires, they might loosen the bands which will be put on your last molar tooth. So please avoid consuming hard edible items. If you want to have an apple, yes please, but cut it into pieces and then eat it, chew it with your back teeth, not as a full raw apple like that. Next is the food to avoid would be the sticky, sugary, pasty kind of food. Say for example, the pizza, the burger and all that, which tends to pull your teeth apart. So the food can get into the spaces of the bracket and it can remove the bracket from their original place. And of course, the most important would be the sweets. Please avoid chocolates and please avoid any kind of sweet. I would even please go ahead with chocolate ice cream. I'm okay for it. But sweets and chocolates, they are so sticky. They get stuck in between all over the brackets. It becomes a very messy job for you to clean the teeth then. So basically to avoid, I would say the food which are very hard. 2, the food which are very pasty and sticky. And 3, sweety kind of food, but I'm okay with a milkshake or an ice cream. Alright. So the foods to enjoy. The foods to enjoy would be the soft foods like a banana, like a rice, any soft foods which are easy to chew, which does not get stuck in between the teeth are okay. A most important warning would be don't chew on the ice. Some people have the habit of taking big ice cube from the fridge and chew on them. Please don't do it. The ice has that great strength to break your bracket into two when you chew it on in between the teeth. So don't please chew it on the ice. So these are basically the foods to avoid and the foods to embrace. So I would say that what are the common challenges that you face during this 1.5 years of orthodontic treatment. The first and foremost would be the ulcers that you experience probably the first 2 weeks after the treatment. So as a handy, I've given you a gel and a bubble gum. If you develop an ulcer, immediately use the gel, fix an appointment with us. But till you come to our center, please don't suffer with pain. Take a gel and keep a bubble gum over the broken bracket or the ligature wire or the band. The second most important challenge which you would experience might be dry mouth. You would find it difficult to talk because of the stickiness of the mucosa. So that would you have to ensure good salivation and nothing else. When you come to us, we have something called an oral hygiene score. From the day one when the orthodontic brackets are placed, we take complete responsibility of your oral hygiene. So during your initial treatment, we would mark the score of your oral hygiene. We have 5 scores starting from 1 to 5. Score 1 means very poor maintenance, 2 average, 3 good, 4 very good and 5 excellent maintenance. And we would expect you to have score 5 all through the course of orthodontic treatment. When you see score 1, did you see the health of the gums? They are swollen, they are shiny, they are very edematous, they are painful too. When you see the score 2, which means average maintenance, you see a lot of red gums. Normally, the gums are pink and they are not red. Score 3, you see the gums are still slightly red in specific areas, although they are shiny too and edematous. Score 4, which means good, they are good but they have traces of redness in between them. Score 5 means the health of the gums are perfect. They are firmly attached, they are not swollen, they are not shiny and they are not edematous. So when you take care of the brushing, flossing and the maintenance of the gums with the rinsing, you would also ensure that you will always be in the score 5. When you come to a center, we would give you a score month on month based on your maintenance. If the maintenance goes low, we have certain therapies to bring back you to the score A, that is the score 5, which means excellence. So your maintenance is directly proportional to the health. When we maintain our teeth, when we maintain our salivation, when we maintain our soft tissues, and of course when we are highly disciplined with our food habits, we would definitely go to a score 5 during the entire course of orthodontic treatment. Thank you so much for the time.